Hi. Hello, hello, hello. Hello, my beautiful warriors. How are you guys? I hope you all are doing well. I hope you all had a safe and happy 4th of July weekend. I hope that you were able to enjoy the um, the celebrations and the festivities and your family and friends. I I did mention in our last drop that Bubby and we had plans to go to the fireworks. Unfortunately, that changed, and this is why it's so hard to make plans. I ended up coming down with a headache that lasted all day, so regrettably, I had to back out of going. So we did not go. My neighbor and I were supposed to go to the fireworks that evening by where we live, and I ended up not being able to go. So Bubby and I didn't go. I stayed home instead and rested my head and tried to get rid of the headache. It finally did go away later on that evening. Um, and then the 4th of July, oh, I am not anti celebration of, you know, uh, holidays or important events or anything like that. It just makes it really hard because my anxiety, I didn't have my earplugs in, which that was my fault. I should have put them in before I went to bed, but I didn't. However, it wouldn't have really mattered. Um, where I live, I'm kind of like in it's noise travels. It's very echoey. It's like you know, it's very loud than it probably actually is because of where I'm positioned in my community. And there's a street next to our community, and they were letting off. Obviously, they were celebrating the 4th, and they were letting off fireworks. And I don't know who thought it would be an amazing idea. I don't know what the laws are where you all are from, but I am from Michigan, and Michigan state law says that fireworks start at 10 and they end at 11:45. To me, that's awfully late. I remember when fireworks would start earlier and be over by 10:30. But I guess because of, they're waiting for the sun to go down and it to be a little bit darker before people start the festivities. So it's from 10 to 11:45. So anyhow, that was a rough night, only because I was jarred awake. It's a very large explosion. Again, where I am located, sound echoes, and it can be very loud. And again, we did speak about the fur babies, right? And having patience with them because it scares them, it startles them, it just hurts their ears. And some dogs are fine with it, and other dogs, and I really do believe it's probably the breed of the dog, but some dogs will sleep right through them and it doesn't faze them, and other dogs not so much. And the ones that are on that not so much list, you have to be a little bit patient with them. You have to let them know that yes, it's loud, it can be scary, but you're okay. And so I was jarred awake, and so it was Bubby. So it was a rough hour and a half, hour and 45 minutes. But we got through it. It was a late night. He didn't get much sleep that night. Every time he would get, settled, because it wasn't like back to back to back. Obviously, there's a break in between. So every time he would get settled and it would get quiet, he'd fall asleep, and then bam, the next one would go off and he'd be jarred up again. At one point, I did take him outside to let him just bark and get it out of his system. And again, it was getting later, so I shushed him because I didn't want him barking and waking up the neighbors on top of, the fireworks. So I brought him back in, and I was patient with him. I was a little cranky because I was woke up as well. I had a headache the day before, and I had a headache that morning of the 4th, and living with the disability that we live with, there have been many a times I've ended up having all-nighters. Even with the medications I take at night to help me get sleep and to help me relax, there have been times where I couldn't fall asleep and I would pull all-nighters. And I'm sure there's many of you out there that have done the same thing. So when we are able to find that comfort spot, and we are able to relax and we are able to sleep, our sleep is very precious to us, because our body is always in fight mode. It's always trying to defend itself and fight off the pain and all the signals that our brain is giving our body. Our body is constantly in fight mode. And so when we are finally able to stop our brain from doing what it does 24/7, it's very precious that we can get that sleep. And so when it's interrupted, especially very abruptly, we're not happy campers. So on top of me being woken and having to deal with the fact that I was grumpy, I had to try to be patient and understanding with Bubby. But we got through it. We got through it together. Again, like I said, he's still, I don't think he'll ever 100% be okay with them, but I do feel that he's gotten better. When I first got him, he was rehomed to me by my daughter's boss's sister. That's how I came across him, because I was looking for a dog, and when he came up and needed a new home, my daughter reached out to me, and I absolutely said yes. And he was very anxious. He's he's a good boy, but when it came to loud noises, he was very anxious. He also doesn't like it when I chew gum. So I don't know if something was done to him or that traumatized him in that way, where he just doesn't, he doesn't like it. So I work with him a little bit because I'm a gum chewer. I work with him a little bit. I will throw in a piece of gum occasionally, and he will sit there and he will stare, and he just stares and he just stares like he's waiting for something to happen. And that's the only time he does that. And I've even tried to sneak a piece, and he knows. I don't know how he knows, but he knows. I mean, I'm chewing. It could be food, but he knows it's not. So he doesn't like gum chewing, and he doesn't like booms. He doesn't like the fireworks. He doesn't like gunshots. When we lived in Lapeer, it's a very rural area, and there are people out there hunt, and there's shooting ranges out there. And so when the hunting season was amongst us, and he'd hear that, he would go bazooka. And so I worked with him with the gunshots, which I'm not a fan of them either. I don't like guns. I don't. And so I have anxiety on top of it, and I'm trying to help him with his anxiety. So he doesn't like gum chewing, he doesn't like gunshots, and he definitely is not a fan of the fireworks. So when I first got him, he was really, really bad. I remember the first time I put a piece of gum in my mouth, he went and hid. And then I am a popper, which I have now over the years. I don't pop my gum anymore because he didn't like it, and he would grow. And and I'm like, it's just gum, Bubby, it's okay. And he doesn't care I don't know what it is about gum, but he's not a fan of it. And so when it came to the fireworks, because that was the first thing that I worked with him on when I first got him, oh my goodness, it was hard getting him it was hard getting him to calm down. He was not listening to any commands that I gave him, and he would just go crazy at the window or at the door, and he would not stop. And so there are people that would let them off during the day, and he would go through it. And then, Michigan since then has put in rules that the only time fireworks, because I remember it would be the whole month of July, and they would do them in May, and then it'd be the whole month of July. They would do them for Labor Day, for a couple days, and then it would be the whole month of July, and then it would be into the following month, like the first week of the following month. And so finally, Michigan had to put in rules that the only time that they are permitted, and you can look this up. So if you live in Michigan, I advise you do your homework, because the fines are not pretty. They allow it New Year's Eve, Labor Day, and the 4th. So they're very strict. They've gotten very strict with the rules for the festivities, for the fireworks, because people were just getting crazy. And it's they're noisy, and we have noise ordinance here as well. So it's like it's an interruption, especially when you live around people that work and they're trying to sleep because they have to be to work the next day, or you have a couple that has a new baby and that baby's trying to sleep but you're being, so they've really instilled that rule of thumb, and they will fine you, and the fines are high. If you have a couple of $1,000s to just give away, well, but so there are rules, there are regulations, there are times, and if you are caught doing it outside of all of that, you will be fined. But anyway, so yeah, he's gotten a lot better. I think too it's because there's only been one time that I was not with him during the 4th of July, and I should have brought him with me, and I didn't even think about it. And when I got back, he had such an anxiety the entire time that I was gone. It took me over an hour to get him calmed down once I got home. And I made that mistake, and that's a mistake I will never make again. So yeah, he's gotten a lot better. But again, you just have to be patient with your fur babies. They don't understand. They don't know why you're letting off these big loud booms. It hurts their ears. Their first instinct is to, protect. And they hear something that's not normal, and to them that's a threat because it's loud, it sounds aggressive. And so their first thing is to protect, and that is why they go into that barking mode. That is why they get anxious, because they're just doing their job. So, but anyway, that was my 4th of July weekend. I didn't do anything. I ended up, when the time came, I gave it all day, and by 6:30, my head was still hurting. And so I texted my neighbor and told them, I'm sorry, I'm going to have to pass. And then she wasn't feeling all that great either. So she ended up not, she's like, yeah, I'm not feeling all that great either. So she says, maybe next time. So we'll see. But yeah, so I want to talk a little bit. I watched a movie. In fact, I shared it here in our community, in the community tab post. I think it was called The Good Mom, or The Good Mother, or A Good Mother, or something like that. But I watched it yesterday. It's a Lifetime, and YouTube, they have movies that you can watch. And this was a Lifetime movie. It's based on true story. It's about I'll just give you the outline of what it's about. It's what it boils down to is it's based on a surgery and a process that we've talked a couple times about, and that is the SCS. And while I was watching, I'm like, oh my gosh, I have to share it here with y'all. So if you get a chance, if you get a gander, click that link in the community tab and watch it. There's so many, And this is an older movie. Again, you know, just like with the Golden Girls, I shared that with y'all as well. And this is an older movie. And you know, when I say older movie, I'm talking 80s, 80s, 90s, and it just goes to show how far back our fight and our struggle has gone. I mean, when you know, when you're talking Civil War, when you're talking again, my community, we found at one point that there was a case, I believe it was in Spain back in the 1700s. There was a case in Spain reported. So, I mean, this disease goes back, you know, before any of us were even thought of. Um, and to know how far back this disease goes, to know how far back some of these surgeries go, um, it boggles my mind how the proof is in the pudding. The everything is in front of them. They're witnessing it with their own eyes. They're hearing it with their own ears. And yet, and yet, I'm not going to talk about family and friends today. I want to talk about the doctors. I want to talk about how many doctors out there still, and if there's any doctors out there that watch my channel, please, I would love to hear your opinion on why you think we're faking it. I would love to know why you think it's all in our head. I know why. I know a couple reasons why you feel that way. The number one reason is you can't see it under your telescope. You can't see it under a microphone. You can't see it. And a lot of doctors, if they don't see it, oh, you got to be making it up. Who would go through this? I mean, there's people out there that have had amputation, that have had limbs, parts of their body removed. You're gonna tell them that they're making it up too, that it's all in their head, that they're just being foolish? Really? I am not the only person that now has a deformity and other issues wrong with them. I have met amazing people that have deformities, that have other issues wrong with them. And it's all because of the CRPS. It's all because of one thing. You know, some of the people that I've met along the way, um, either it was from a surgery they had that went wrong, or they were injured. And so those are my two top. You know, I haven't met anyone. You know, they say too that people that have had strokes can develop CRPS. I've not met anybody that has developed it because of that. The people I've met have been either surgery or injury. And, you know, these people that I've met along the way had lives once too, had jobs, had hobbies that they enjoyed doing, went on trips with their families, enjoyed the holidays with their families, just enjoyed life with their spouses and their children and grandchildren. And because of one stupid thing, one stupid fluke, their life had to change. I was simply working. I was at my job working, doing what I got paid for. And I ended up getting injured because of the lack of somebody else doing their job. But I ended up getting injured because I was doing my job. And I didn't ask for this. None of us do. It's not in our head. You know, we were living perfectly normal lives until one day, until that one stupid fluke changed everything. And I just get so angry at doctors, at these doctors that, and I'm not going to say at doctors because it's not every doctor. There are doctors out there that actually believe this is real, that actually try with everything in them to help. And that was another reason why it wasn't just about the boy in this movie that I shared, but it was also about the doctor who went out of his way because he felt that this would work. He felt that he had to do this. He went out of his way, and he made it happen. And it wasn't just the fact that this mother did everything she could do to help her son. She had, I mean, her son was put on everything under the moon. They had tried everything that they could possibly try, and nothing was working. And so this mother uprooted, she ended up getting divorced. And so she was a single mom on top of having to deal with this. She had 2 boys, and she moved her boys and her out of the state they lived in to another state because she heard how this was possible, how this one thing was possible, and she did everything she could, and they were so close to finally being able to figure it out. And then the insurance company didn't want to pay for it, for the surgery that could possibly help her son. They didn't want to pay for it, and they didn't want to pay for it because they didn't believe it. They didn't believe in the surgery. They didn't believe in the method. They didn't believe in any of it. But however, ironically, the insurance had paid for all the other medications that her son was put on that didn't work. They paid for all types of therapy for him. They paid for all types of physical therapy for him. But there was this one thing that could possibly help her son, and the insurance said no. So what did this doctor do? He went out of his way. He went beyond his professionalism and decided to do a study. Now, when doctors do studies, the hospital would pay for it because it was a study he was doing, and he would write a paper on it. And it would be in the medical books. It would be in it would be out there. And so obviously, when there are new things coming and there are different surgeries and basically, and even now, having that surgery is not a guarantee. And the doctor was very forthcoming with the mother. He said that it's not a guarantee, that it was still very new, and that there are some cases where there are complications. And when I heard that, I thought about so many of my warriors within our community that did not have that education about the transplant. They did not have that education about this device that was going to be implanted in their body. There was no education taught. There was nothing talked about. There was nothing put out there on the table so that they can make that decision whether or not they wanted to have it done. It was just brought to them, and bam, they had it done because they're doctors, and I have not witnessed it, but I have heard it. I have been told it. It has been shared with me by numerous different warriors of mine that they had it, and it did more damage than good. I have had warriors have it done, and they've had to have it removed because it did damage. And those are the prices you pay for trying to find relief. And the ones that have had to have it removed and had this damage and this, that, and the other, there was no education before. I have had it brought to my table, and my doctor gave me all type of reading material. He gave me a DVD to watch. We had a 30-minute conversation about it, and it ultimately was my decision, my choice, my body, my choice. And I have met wonderful, wonderful, wonderful warriors who did not get that same courtesy that I received. They were not given materials to read. They were not given a DVD to watch. They were not given a 30-minute conversation. They weren't educated. And the only thing that they were told was, this is what we're going to do for you, and it's going to heal you. You'll be back to work tomorrow. I actually had a warrior who their doctor said to them, you will be back to work in a couple of weeks. You will have your life back. Guess what? She had to have it removed because the lead had somehow wrapped around part of her spine, and it did more damage than anything. And she went in, and this is the thing too, I don't tell or share these stories to scare you guys. My reasoning for sharing with you is to educate, because I know a lot of you don't get that. I have met a lot that didn't get that. And it boggled my mind that this doctor, and I understand maybe he was just trying to go in on a positive note, and maybe he was trying to help her feel better about the situation. That's all fine and dandy, but you have to be honest. You have to educate your patient. They're not the doctor, you are. And they're trusting you with what you say. If you tell your patient, yep, you'll be better tomorrow, guess what? They're going to believe you. Because why? You're the doctor. There are a lot of doctors out there that, this has been an ongoing debate with our community. The community is no longer, I retired the community because it was just getting to be too much. But I do miss it. I miss it very much. But when we had our community, the one ongoing conversation piece was the SCS. Now, there were people in our community that had success with it. And then there was ones that did not, that it only made their condition worse. It did not give them any type of relief. It did not do anything. Now, mind you, before you have it implanted, there is a 7-day trial that you do. And some of them said that they had remarkable relief with the trial, but when the actual device was implanted, they had nothing. And so, yes, and there are times where it's going to have to be adjusted, where because it's very complex. It's not just a simple little device. There's a lot to it. But after I was given the education on it, I decided not to do it, because my doctor was forthcoming. He was truthful with it. He was honest about it. He gave me the pros and the cons. And I already know what my limitations are. And it's probably a good thing that I didn't get it, because I have scoliosis now. And the SCS was brought to me prior to the scoliosis. But I decided not to do it. I decided to keep doing what it is I'm doing. With the treatments I get and with my medications, I feel like for now it's good. It's okay. It's not good. I shouldn't say good, but it's okay. I'm able to get through. Do I still have hard time? I'm still yeah. I mean, my medications and my treatments aren't a cure. And I know that. When I received my medical team, which are great, by the way, again, my doctor was very forthcoming. My doctor was very honest. What was that? Something just hit my window. Might have been a bird. It might have been a bird in a tree. But my doctor was very honest about everything. And so that's what also helped me make the decisions and choices that I needed to do. And there are a lot of you out there, and again, this is for you doctors. There are a lot of you out there that are not honest, that are not forthcoming, that don't take the time to educate your patients. And a lot of you, again, this has been a conversation when we had our community, a lot of warriors unfortunately feel that the ones that just pushed and pushed and pushed for them to have the surgery, it was about the money. It wasn't about you helping your patient. It wasn't about you wanting to see them succeed in this process. It wasn't about any of that. It was about you and your wallet. And I sadly have to agree. You know, this is the thing too. When you become a doctor, you take an oath, and that is to do no harm. You know, and part of the movie that I shared with you guys here, there was a statement that he made, the doctor. And when he made it, I was just like, wow. If this was only real, like it was based on a true story, so this actually did happen. But if this could be true still today, this doctor confessed to the mom. It ended up being a love story. Okay, they ended up falling in love and they ended up getting married. I know, spoiler alert. But he was honest with her. And he said to her when he was confessing his feelings to her, but he said to her, before I met you and your son, I was numb. I detached myself from humanity. I didn't feel anything. He said, when you become a doctor, unfortunately, in some cases, doctors forget how to feel. They detach from humanity. And he also said, in some cases, it's to protect the patients and to protect the doctor. But I understand that part to a point. But he admitted how he can feel again. And that's why he fought so hard to make this happen. Because he, along the way, found humanity again. And there's a lot of you out there that have absolutely no soul. I understand that there is a patient and doctor relationship. But that doesn't mean that you have to forget how to feel. You know, I am a motivator. That is what I do. I do it because I know how it feels. I do it because I have respect for human life. And I do it because if anything I say helps just one person, just one, it has to start somewhere, right? I've shared before how I've been often asked about why, have I ever thought about being a motivational speaker? No, I haven't. It's just natural. It's just what I do. I've had a lot of circumstances and situations in my life that has given me experience where I can speak on things. And I've met a lot of people along the way that have had similar things happen to them in life. And I'm not trying to toot my own horn or anything, but if anything I've ever said to anybody has helped anyone, then I've done my job. I'm not claiming to know everything. I'm not claiming to have all the answers. But I know what I know and I feel what I feel. And I just share that. That is what I share. And if you doctors out there that have lost all sense of reality, that have lost the ability to understand human life, for you that have lost the ability to have respect for that person that you are caring for, then what's the point? Without that, you are not a good doctor. Without all of that, you are just somebody who is in it for a paycheck. I'm just going to say it. And I think you know. I think if you took a long look in the mirror at yourself, I don't think you would like the reflection. I don't think you would like what's looking back at you. And that is what you give your patients. That is what you show these people that are trusting you to help them. When we come to you, we are coming to you because we are trusting you that you're going to somehow, some ways help us. A lot of us have been tossed back and forth to so many different doctors. We have been put through hell. We have had to jump through hoops of fire to be heard, to be believed. And so when we find a doctor that claims that he has answers, that he has dealt with certain things that connect to our disability, we are coming to you with hope that you will have an answer. And if you don't, we are coming to you in hopes that you will find it. Why? Because you're the doctor. You're supposed to know these things. You're supposed to care enough to try to even attempt to help us. You know, when people go to doctors, they're not going there with the thought of, oh, this guy isn't going to care, but I'm going to go anyway. No. They go with the hopes that you will understand and believe what they're saying, what they're going through, what they're experiencing on a daily basis. We are coming to you with the idea, this crazy idea, that you will help us and believe us and trust us when we come to you saying, hey, this is what's going on. We come to you pouring out our guts to you, telling you things that are happening. At the end of that visit, we don't expect to be told it's all in our head. We're making it up. We're making more of what it is. I'm going to send you to a psychiatrist. That is not helping. That is belittling. Belittling somebody who doesn't know what's going on, who is scared, who just wants to live their best life, who is looking and searching for help, for guidance, for understanding. And when you don't give that to us, that is the worst thing. We already deal with the negativity and the rumor mill and the gossip and the eye rolling and the abandonment. We already deal with all that from our family and friends. And sometimes you are the last person that we can trust. You are the only one that is going to listen. So we believe and so we think. Don't abandon us. Don't slap us in our face. We get that already from family and friends, from the world. The world that we are living in, that we are being forced to fit our disability into, it's not set up for us. If we're not like you, we're crazy. We're making things up. We're attention seeking. We're out there trying to get a quick fix. And I'll grant you, grant you, there are people out there that hop doctor to doctor to get those pain pills. But I can promise you, we don't want to be on medication. We don't want to have to keep taking medication throughout the day just so we can function. That isn't what this is about. And that is the first thing. You're lying because you just want pain pills. You just want pain medication. You just want to, so you're lying to me. This is what doctors are thinking and saying. And this is why they will say, I'm going to send you to a psychiatrist. I can't find nothing wrong with you. You're perfectly fine. All of your test results came back normal. I can promise you none of mine will. I've had CTs, I've had MRIs, I've had x-rays, I've had physical therapy, I have had, you name it, I've had it. The only thing I haven't had is that surgery. And you know what? My doctor never pushed it on me. He gave me the option, he gave me the homework, he gave me the information, and at the end of the day, that was my choice. And my choice was this. I told my doctor, very simply, I think what we're doing right now is working. I don't want to have the surgery. I don't want limitations put on me. I already have limitations. And if you're educated and your doctor is giving you the proper information and the proper tools to educate yourself, you will see that there are restrictions. When you have that implant put into your body, there are restrictions. I have had some that have had to have it removed because it has shifted or it has wrapped around something. And the reason it did that was because they were just living their life. And they weren't applying the restrictions that go along with having this SCS planted. There are restrictions. There are things that you cannot do. There are things that you have to do differently. Because in fear of it moving, because in fear of it getting wrapped around something else. I already have restrictions. I didn't want any more. And that is another reason why I opt out of having it. I know when I go in for treatments that it's not a guarantee it's going to work. And I have had that happen. That hasn't stopped me because I know the times it has outweigh the times it hasn't. And I know it's a 50-50. Every time I go in there, I know that I could, something could happen. I know that. What I get done is very serious. And I'm aware of what could happen. But I'm also aware of what has happened. And even before my doctor started these treatments, we had a conversation. And every time I go in, they read me off that list of things that could happen. And that list is scary every time I hear it. But because I know how much my treatments have helped, I continue to have it done. Because right now, that's what works for me. I don't want to have surgery. If I want stimulation, I will pull out my 10 unit, put it on my leg, and turn it on. That's my SCS. Because the SCS does pretty much what the TENS unit does. It stimulates. It's giving off little shocks. That's all it does. But it's a lot more serious because it's implanted within your body. And you have to be careful when you have that in your body. And a lot of you doctors out there don't share that information. Why? Because this is what you're focusing on. You're not focusing on the well-being of your patient. You're not. If you were, you would educate them before they have the surgery. You would give them the proper educational materials that my doctor gave me before you would do that surgery. You would have a consultational visit before you perform that surgery. And you would allow your patient to make the decision. A lot of doctors, and a lot of you have, so whatever, you can deny it all you want, but I know it's true because I've heard it. I've heard it from other warriors that have had the surgery presented. They weren't given the option. They weren't given the educational material they needed to know what it was that was even being in their body. They were just told, this is what we're doing. And it was done because they trusted that doctor to know what he was doing. They trusted that doctor to know and trusted what he said to them. A lot, and again, this was an ongoing conversation. My God, it was never ending because we would get new members that had it, and again, we had members that would chime in and say, hey, it's worked great for me. You know why? Because they had doctors that educated them, and that was their choice at the end of the day to have it done. And then I've also had members that had it done and ended up having serious injuries, internal injuries, had surgery to remove it. And by removing it, it even made it worse. And there was some that couldn't have it removed because of where the location, it had moved and it had wrapped around things, and they couldn't go in to remove it because it could be even worse off. It could make them paralyzed or worse. So, yeah, these are all very scary thoughts, but they're all reality. They're all true. And these are other things that you have to incorporate into that. Oh, I'm going to cure you and you're going to be on your feet, and in a couple of weeks you'll be back to work. A doctor should never make promises, number one, because nothing in life is guaranteed. Now, you can go in with the hopes and desires that, yes, it's going to help. Obviously, yes. You absolutely. That's the one thing that we would talk about, is having that positive outlook, having that positive attitude about something, because this is something that we need so badly to work. And so we go in. I even go in with the treatment, with the thought of, I can't wait for it, that's always my thought. My treatment's worn out. In fact, I go in next month to have my synthetic nerve blocks done. And I'm going in with the hopes that I'm going to get that relief. But I also know as well that it may not. And that's the reality of it, though. My doctor has never once told me or promised me anything. There's never been any false promises. It's always been legit and true, and the reality of it. And some of you doctors don't do that. And I think by my doctor being so true and he's trustworthy, and I've told him that. I trust you. My doctor knows I trust him because he's earned it. He has shown me that he's not full of monarchy. He has shown me that he's not full of crap. He has proven to me that I can trust his word. And I've been going to him now 12 years, 11 years, 12 years. I didn't have him my first year. I was tossed, 27 doctors in my first year alone. I was tossed to different doctors. They would send me here and send me there and, whatever. Until finally I ran out of doctors, apparently, that they could send me to. So they're like, well, you know what? This is the only thing we got left. Let's send her to Ann Arbor. Let's send her to U of M. And that's where I've been ever since. And I travel for that treatment because I know my doctor. I have formed a patient-doctor relationship with him. I trust him. I know I can tell him things and he's not going to come back to me and say, oh my God, it's all in your head. I know this. I have a psych therapist. I just had an appointment yesterday, and he knows. He knows. They convert back and forth. He has seen me in my worst. I have cried because I was in such severe pain. I remember one time, this was quite a few years back. Um, I went for a follow up, and this was before the pandemic. So this was before virtual appointments. And I went in for a follow up, and I knew I was getting close to time. In fact, that was the one thing that him and I were going to schedule, was another, because you have to understand, guys, our treatments are not scheduled. Okay. So when your body is starting, when the medications that I have inserted into my nervous system, when it starts wearing off, I already know when it's going to wear off. Um, there are symptoms, there are little clues that I receive just before it's completely worn off. But I had an appointment with him, a follow-up appointment, and I was in his office, and I knew it was wearing off because I could feel it days prior. And that was one thing that I was going to speak with him about, was scheduling an appointment. And I remember sitting on the table getting examined, and all of a sudden it was like a bolt of lightning struck me so bad. And U of M is a teaching hospital, so my doctor is always there, but he has a student with him. He has somebody that's learning the ropes. And so they will sometimes examine me. They will sometimes even do my treatment procedure, but my doctor is always there. They're always guiding each other. And again, you have to have a lot of trust to have somebody like that, someone who's learning, actually examine you and do. My doctor has done my treatment himself, but when he has a student there that is learning, they are hands-on. It's a hands-on training hospital. And so I remember sitting there, and he was trying to examine me, and all of a sudden it was like someone just took a hot, dull poker and just jabbed me. And I was in such pain that I started crying. That appointment, he called, my doctor went out of his way. He could have sent me home that way, but he didn't. He called and said, hey, we're doing an emergency sympathetic nerve block. Clear a spot for her. We're sending her there now to have it done. And I did. I ended up having it done that day. And I was in such tears, and I was in such pain, and I couldn't breathe. The pain was so bad, it was taking my breath away. And they cleared a spot. They rolled me in, and they did the procedure right then and there. He didn't have to do that. He could have sent me home in pain. He could have been like, well, let's schedule you and see how close we can get you in. He didn't do that. He's right then and there. And that's having humanity. That's having the connection with your patient, knowing that they are not lying, that it's not all in their head, that when they are displaying such trauma, and you go out of your way to help that person, that's a good doctor. That's somebody who believes their patient. These treatments, you go through a lot to have them done. And somebody who is cuckoo, or it's all in their head, is not going to put themselves in that situation. They're just not. Sorry, my phone was blowing up, or my watch was blowing up. And so this is the thing for you doctors out there that just don't have any type of respect for humanity at all. You don't need to be a doctor. We need more doctors that have respect, that aren't numb, that connect to their patient on a doctor patient level. Okay, you can still have that connection with your patient and be professional. That is what my doctor does. It's very professional patient doctor relationship, but he has that connection to his patients where he hasn't lost humanity. He hasn't become numb. And a lot of you doctors have, and a lot of you doctors need to figure it out because you are damaging your patients. We're already going through, I'm getting hot, sorry. We're already going through so much right now. Out of control body temperatures. One, if you notice my face got red. Um, I've been pretty good with those. I haven't, they come and go. Sometimes I get relief and I don't have it for about a week or so, and then bam, there it is again. Um, we are just trying so hard to live our life. We are living in a body that we don't recognize. We are living in a body that is no longer ours. Right now, I'm experiencing weight gain. You know, I try to go on walks twice a day. I've started that the other day. Um, it's hard for me to walk because of the pain, especially now with it wearing off. I get a lot of groin and hip and lower back pain. So I am going to start taking my walker. I try to, um, I try not to use my walker. And I've been scolded. I'm supposed to use it all the time. For the most part, I do, but through my house, I don't, unless it's a really bad day or I'm in recovery. Um, but when I'm out and about, I should be using it all the time because I have fallen. I have fallen a lot. Um, you know, and the last thing I need to do is break a hip. Yeah, it's never good. Um, but there are times, there are moments where I lose hope. And when I'm in that mindset, I something always is brought to me to change it. And yesterday, when I came across that movie, because there have been moments lately where, in fact, I think I even told you guys this before, I'm not I'm not in love with this world anymore. I have fallen out of love with this world. You know, we we as people need to start respecting. In fact, this was kind of a part of a conversation I had with my therapist yesterday, was just having respect for each other because we're all human. And to have respect for each other is to have respect for human life. And I don't know what has happened, but we've lost that along the way. And over the years, it's only gotten worse, not better. And it needs to change. Um, we need to change. And anyway, get off track. But I wanted to kind of address and confront the doctors today because, and not all doctors, like I said, not all of you. There are doctors out there that actually do give a damn, that have not gotten numb, that still have that connection to human existence, that human experience. that have respect for human life, that listen to their patients and understand and go beyond to find a way to help them, to figure it out together. When you have a doctor, you're supposed to be a team, right? And I know some of you are still very intimidated by the white coat. I don't know why. They're they're people just like you. And you are there seeking their help. They work for you. It boils down to they work for you. And if they're not working out for you, don't be afraid to fire them. Don't be afraid to tell them exactly how you feel. I have there are quite a few doctors out there that have heard how I feel. um, and my doctor knows that I'm not afraid to say what's on my mind. Um, and he respects that. And I respect him. And I trust him because he has shown me I can. And if you are not showing your patients bedside manner, it matters. It matters a lot. Again, we're going through so much already. Why do you want to put us through more? If we can't trust our doctors, oh, there's a bug in my coffee. Well, that's not nice. That totally ruined my day. But if we can't trust our doctors, if we can't trust them enough to talk to them, I just don't get it. I don't understand how you can take an oath. I get it. We all need to financially be able to take care of our families and to provide for them. I get that. But if you're gonna be a doctor, you need to be in it because you want to help, not just because there's a fat paycheck behind it. And granted, when you go to college and you pick a career, yes, you want it to be something that you can survive with. We all do. But I think that some of you feel that you are above everybody and that you can treat your patients any way you like, and that's fine. That they're to bow down and kiss your ring. No. I don't kiss no one's ring. And I sure in the hell don't bow down. I remember once they sent me to an insurance doctor when I was on workman's comp. And this doctor thought that he could just grab and manhandle me any way he wanted. And he broke so many rules and violated so much. There was no nurse. He shut the door and it was just him and I in there. And he thought he could just handle me any way he wanted. Guess what? No. And then after I left in tears, I reported him. Everything I said to him was a lie. I was making things up. I sure in the hell wasn't born with a drop foot. I wasn't born being in pain 24/7. I wasn't born with scoliosis and problems with my neck. I wasn't born with memory problems and speech problems sometimes. I wasn't born walking with a walker. So no, I'm not making any of this up. It's real. It is here in front of your face. And that is the problem with people, especially doctors. You complain that you can't see the disability? Are you serious? It's standing in front of you. We are the disability. If you go back and look at our medical charts, you will see and you will find that we are being honest, that we are telling you the truth. I have medical charts going back from 2014. And if you check my medical history, you will see that there was nothing before that. So if I'm going to make crap up, why wouldn't I have done it sooner? You're going to see that I've been working since I was 16 years old. You're going to see that I had 3 children. You're going to see that I was married. You're going to see that I owned my own homes. You're going to see that I was capable of driving and understanding the English language. If you really want to know about your patients, get to know them. Nobody just wakes up deciding one day, I'm going to fake being sick. Nobody puts themselves through the hell that we have to go through with our treatments, and some with surgery and some with amputation. Some that become wheelchair bound, and I'm heading in that direction. You doctors need to open up your eyeballs. You need to grow a heart. You need to understand and respect your patients. I don't know, and Dorothy said it best. You doctors lose your humanity. And I don't know why. I don't know how you can treat somebody and be so cold and numb to it and not feel a thing. I don't know how you do that. I don't understand that, and I never will. Your patients need you. They need you to listen. They need you to hear them. They need you to understand. They need you to be a doctor. They need you to do what you took an oath to do. For my warriors, we're going to go. I am wishing you all an LPD. I am sending you gentle hugs. And I hope that you have a good doctor. I hope that you have a good medical team. I hope that you are being heard. I hope that you are being understood. And I hope that you're getting the treatments that you need. And most of all, I hope and pray that you are able to live your best life, because you deserve it. You deserve to be heard. You deserve to be happy. You deserve to have support. You deserve to have a medical team that's there to support you, to stand behind you. I hope and pray that you are getting everything and more. For you doctors out there that have no respect for human life, don't care one way or another, all you care about is that paycheck, I feel sorry for you. I hope that one day you wake up and realize the damage that you have caused your patients because of the way that you've treated them, the way that you've spoken to them, the way that you didn't listen when they needed you to listen. Take responsibility Live by that oath that you took when you became that doctor. You need to learn how to go beyond, reach out, and help that patient in need any way you possibly can. They need you. I'm going to go, and we will talk again real soon. And in the meantime, ciao for now. Bye.